Welcome to VedhikaTv viewers. Let us talk to Dr. Moonot. Hello, doctor.
Hello.
In our olden days, we have to see 60 to 70 years of age group used to have joint pains or ankle related pains. But at present generation, we are seeing at the age of 40s or early 50s, mostly in the IT industry, people are complaining about the joint pains. So what do you say about this?
Let me start by saying there are two parts to it. One is in a previous, we would say, of grandparents' generation, life expectancy was only 60 to 70. Now we are looking at expectancy of at least 100. We are almost touching that as what we would do at the western side. So people have become more active. Now, if they become more active at 60 and 70, so whatever is related in terms of disease, like in joint pains, arthritis, they want to get treated about it. My grandmother, she was like 60 arthritis, she didn't want any treatments. But the present generation wants to get treated. So that's why the surge in the number of people seeking treatment is there. The younger generation, and as you mentioned, IT industries and other industries, the lifestyle has become very sedentary, you know. So the previous generation, they were very active. You didn't have the likes of home deliveries and the Swiggies and the Zomatos. So people used to go out, used to go work around, walk and do other activities, which made their joints more active, mobile. The present generation, I wouldn't blame it on anybody, but it's become more sedentary, non-active. So that's why you have more increasing joint pains. Obesity is to a very high level. And of course, then you have other issues as well, thyroid and other things. So all in all, because of this, the bone and joint related issues have taken a big jump in our practice. And that is why I would say people having knee pain, foot pain has increased recently.
Suddenly we might fall from the steps, or while walking or running we might get sprained. So generally we just spray something. So is that effective, or are there any medicines or remedies?
Ankle sprains is very common. One of the most common causes in India of ankle sprain is not sports related. It's usually because of bad roads or pavements or walking on uneven surface where they have a mild stumble. Now the key is how bad was the stumble, how bad is ankle sprain. If it's just a mild swelling and they're able to carry on. So a lot of patients may say, I haven't sprained. They carried on for doing whatever they were doing. And in 1-2 days, they went to see a doctor because there was mild swelling. That's a different kind of ankle sprain to a somebody who really has a very bad twist, sudden swelling, here's a pop, suddenly they cannot even stand and walk. Okay, so that's a gradation of people who are having it. In the first case, yes, icing, so what we call is a price or a rice treatment, rest, ice, cold compression and elevation should work, and they should settle down in 5 to 7 days, maximum 10 days. To somebody on the other side where you have a lot of swelling, can't even stand and walk, not able to do anything, on those cases they should be seeking a doctor's appointment immediately, probably having an x-ray, seeing a specialist, orthopedic surgeon or a foot and ankle surgeon, and treating it appropriately. Appropriately means, of course, rice treatment, but at the same time, they may need a short form of immobilization, like in a plaster slab or what you call as a walker boot, for 2 to 3 weeks, not more than that. And the main thing in any patients of ankle sprain is rehabilitation. And when I talk about rehabilitation, means exercises and physical therapy, and that should be carried on for approximately 6 weeks to 3 months, because when you have a sprain or a torn ankle ligament, you need to make sure that the muscles around the ankle are made strong, that they do not have a repeat ankle sprain. The problem is not just having a sprain, the problem is having this kind of pain and instability over a long period of time, the ankle giving way, you don't have confidence in your ankle, and thereby limiting your activities. Also, if you have a very loose ankle, the chance to the damage to the cartilage leading to osteoarthritis is very high. These loose ankles can, over a period of time, what you call as ankle instability and arthritis, which then you need further treatment in forms of surgery, either a fusion or an ankle replacement.
So what are the new developments regarding this?
We know the fact people having hip replacements, knee replacements, it's like a common thing. It's like drop a coin, go have a knee replacement. But ankle, if people have ankle arthritis, then people just think of, yes, the bones need to be fused. However, ankle replacement is definitely an option now in India. In the western side, ankle replacements been there for last 20-30 years. Just because of non-availability of the implants and proper training, it was not available in India. Till recently, I was the first one to do a live ankle replacements, and more than 8 ankle replacements. I have done it in the last few months in India, and we were the first one to do H3 ankle replacement in India. Patients have been doing very well. The pain goes away, mobility is still maintained, walking is better, and you restore the ankle movement. Ankle is a joint, right? So you have to have movements. You could do a fusion surgery. It is a good outcome. It's also still a gold standard for a arthritis. But over a period of time, you can have surrounding joint arthritis. That means the surrounding joint around the ankle can get wear and tear over the next 10 years. Now you understand, if you have a young person where your ankle is fused, in 10 years time the surrounding joint get arthritis, you have to fuse those joints. So what you are doing is you are fusing one joint over a period of time, one to another, and you giving them a very stiff foot. Okay, that's not what you want. We should always weigh the pros and cons of fusion versus ankle replacement and consider an ankle replacement in appropriate people.
Thank you so much, doctor, for sharing us this valuable information. Thank you once again.
Thank you so much for having me on this show. I hope the viewers have found all the information useful. If there's anything, they can always contact us. Thank you.